acids in promoting fertility. Recommend fish options like salmon, mackerel, or sardines. Point 7. Dairy or alternatives. Stress the significance of calcium and vitamin D for reproductive health. Suggest dairy products or alternatives like fortified plant-based milk. Point 8. Avocado. Talk about the benefits of monounsaturated fats and folate in avocados. Provide creative ways to incorporate avocados into the diet. Point 9. Berries. Discuss the antioxidant-rich nature of berries. Name specific berries like blueberries and strawberries. Point 10. Water. Explain the importance of staying hydrated for overall health and fertility. Encourage viewers to prioritize water intake. Conclusion. Summarize key points. Invite viewers to share their thoughts or ask questions in the comments. Remember to engage your audience, maintain a conversational tone, and include any additional information or personal anecdotes that can enhance the video.
10 weeks pregnant. Your baby's development. Your baby has come a long way in just a few short weeks. That little head is taking on a rounder, more human shape, and by now all the internal organs should be in place and starting to work together. Tiny tooth buds have begun to develop too. Your baby's fingers and toes are growing longer, and the webs that had been between each finger and toe are starting to disappear. At the moment, your baby's eyes, eyelids, and ears are continuing to develop, but they've still got some growing to do before they're fully formed. The size of the fetus at 10 weeks pregnant. Your little one is still growing very quickly. At 10 weeks, the average fetus is about the size of a strawberry, measuring approximately an inch from crown to rump. Mom's body at 10 weeks pregnant. Your uterus is about the size of a large orange at this point, whereas before you became pregnant, it was about the size of a small pear. Around this time, you likely have had or will soon have a visit with your healthcare provider for a thorough examination. At this appointment, your provider may do an internal and external abdominal exam to determine the size and position of your baby, as well as take blood samples for a variety of other tests. These blood tests may be used to determine if you have any infections, what your blood type and Rh factor are, and whether your own immunizations are up to date. 10 weeks pregnant, your symptoms. At 10 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You're not alone if you're 10 weeks pregnant and you're still suffering from morning sickness. The good news? You're likely to start feeling better soon. Morning sickness often goes away after you enter the second trimester. Keep in mind, some moms-to-be experience a more severe form of morning sickness called hyperemesis gravidarum. If you suspect you may have this, speak to your healthcare provider. Round ligament pain. Of all of the pregnancy symptoms you may be experiencing around this time, this one is among the most uncomfortable. Round ligaments are two of the ligaments in your pelvis that help support the uterus, and as your baby grows during pregnancy they stretch and soften. When these ligaments tighten, you may feel pain on one or both sides of your abdomen. Changing positions in bed or doing strenuous exercise may bring on this pain. Light stretching and gentle movements may help relieve the discomfort. If this symptom doesn't go away on its own, or if you also have a fever, call your healthcare provider. Minimal weight gain. Even though your clothes may be fitting a bit tighter, you may not have gained much weight, and you may even have lost a little if you've been dealing with morning sickness. Be sure to talk to your doctor if you're concerned. Exhaustion. You might feel like napping at every opportunity. This could be thanks to the increased levels of the hormone progesterone in your body. Headaches. Some moms-to-be get the occasional headache during pregnancy. If you're experiencing this symptom, try to rest in a darkened room and apply an ice pack to your head or neck to help relieve the pain. Contact your healthcare provider if the headache persists or is severe. Mood swings. Hormonal changes may play a role in the highs and lows you feel when you're about 10 weeks pregnant. You may find it helpful to distract yourself by chatting with friends, watching funny TV shows or movies, or treating yourself to a massage. Just be sure to choose a trained masseuse who knows about safe massage techniques for pregnant women. Vaginal discharge. You might be seeing more vaginal discharge than before, which is caused by your increased blood supply and higher hormone levels. This normal vaginal discharge is known as leukorrhea, and you can expect to see a clear to milky colored, nearly odorless discharge that may appear slightly yellowish on your underwear. Contact your healthcare provider, though, if you notice a strong odor or color changes, or if you experience itching or bleeding around the vaginal area. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. And remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
Baby development at 15 weeks. Your baby is about the size of an apple. Your baby is around the size of an apple or a navel orange. It measures around 4 inches, 10 centimeters, from crown to rump. It weighs approximately 70 grams, which is equivalent to 0.15 pounds. Baby weight at 15 weeks is similar to the weight of one chicken egg. Your baby at week 15. Pregnancy week 15, fetal development. Your baby at 15 weeks pregnant has organs, so now it's time to grow bigger and stronger. Among the milestones of week 15 of pregnancy fetal development is the beginning of bone ossification. The muscles are strengthening, and the bones are becoming harder. By now, the baby has longer limbs and can move its joints. Although it's not common, some women can feel baby movements at 15 weeks pregnant. Your baby is also practicing how to breathe outside your womb. She is actively drawing an amniotic fluid through her nose. It is getting into the upper respiratory tract, developing the lungs. The baby's skin is still very translucent, and small blood vessels are forming under it. Your 15-week fetus is also practicing other reflexes, such as swallowing and sucking. At 15 weeks of pregnancy, your baby is also looking much cuter, since its head is now proportional to the rest of its body. Their skin is getting covered in very fine hair, which is called lanugo and helps keep the baby warm. In the womb, a 15-week baby is also able to hear your voice. Make sure you talk to your baby constantly. How big is my baby at 15 weeks? Curious why your body is, probably, finally starting to look pregnant? It's because at 15 weeks pregnant, your baby is quickly growing bigger each week. He's as long as 4 inches right now and weighs around 2.5 ounces. Baby is looking more like a baby. With each passing week, your fetus is also looking more and more like the baby you're picturing in your dreams. By now, the ears are positioned properly on the sides of the head, they used to be in the neck, and the eyes are moving from the side of the head to the front of the face, where they'll soon meet your loving gaze. Sense of taste. Your baby is forming taste buds, and nerves begin connecting them to the brain. By about 20 weeks, your baby's taste buds will be fully formed. During pregnancy, molecules of what you eat pass through your bloodstream and make it into your amniotic fluid. But your baby doesn't actually taste what you're eating, so don't worry that they won't enjoy what you're having for dinner. Baby movement. Your baby's legs are growing longer than their arms now, and they can move all of their joints and limbs. Your active baby is moving constantly, though you can't feel it yet. Your baby's face. Your baby is looking more like a little person, with eyelids, eyebrows, eyelashes, nails, hair, and well-defined fingers and toes. If you could see inside your womb, you'd catch your baby sucking a thumb, yawning, stretching, and making faces. What's happening in my body? Your baby is growing quickly and comes with a lot of packaging, the amniotic sac and fluid, and their own food supply, placenta. You could start getting the odd jabbing pain on the sides of your bump. This is known as round ligament pain. Putting your feet up and resting can help. Your skin could also feel a bit itchy. It might help to use an unperfumed moisturizer, wear loose cotton clothing, and have a cool bath. If the itching gets worse, especially at night, talk to your doctor or midwife. 15 weeks pregnant lifestyle. Make sure you're getting enough calcium. Since your baby's bones are beginning to ossify, calcium is more important than ever. A prenatal supplement should be able to provide the calcium you need, but you can also increase your dietary intake for an extra boost. Monitor your weight gain. Drastic weight gain can be a sign of preeclampsia. Talk to your doctor if you think you're gaining too many pounds. Keep a healthy diet. You've probably made some healthy dietary changes in the previous weeks, and your 15 weeks pregnant diet should stay healthy. This will help you avoid excessive weight gain. Stay safe. Although advisable to exercise during your pregnancy, 15 weeks pregnancy precautions include avoiding contact sports or sports that carry a risk of falling, like horse riding. Go to the dentist. It might not be pleasant, but taking care of your teeth can actually lead to a healthier pregnancy. Women who develop gingivitis during pregnancy have a higher risk of complications, including preterm birth. Second trimester pregnancy symptoms at 15 weeks. Your pregnancy symptoms may include swollen and bleeding gums, pains on the side of your belly, caused by your expanding womb, known as round ligament pains, headaches, nosebleeds, feeling bloated, indigestion and heartburn, sore breasts, leg cramps, feeling hot, dizziness, swollen hands and feet, urine infections, vaginal infections, darkened skin on your face or brown patches. This is known as cloasma or the mask of pregnancy. Greasier, spotty skin, thicker and shinier hair. You may also experience symptoms from earlier weeks, such as morning sickness, a heightened sense of smell. Mood swings. A white milky pregnancy discharge from your vagina and light spotting. Seek medical advice for any bleeding.
The size of the fetus at 16 weeks pregnant. At 16 weeks, your fetus is now the size of an apple. Your little one could be more than 4.5 inches long, crown to rump, and weigh close to 4 ounces. How big is my baby at 16 weeks? Your baby now weighs in at a whopping 3 to 4 ounces, and is 4 to 5 inches in length. The backbone and tiny muscles in your baby's back are gaining strength, so she can straighten out that head and neck even more. Thanks to those developing facial muscles, your baby is capable of making a few expressive frowns and squints, even at this early stage. Baby's beautiful eyes are finally working too, making small side-to-side movements and perceiving light, although the eyelids are still sealed. Delicate baby skin. Your baby's skin is thin and translucent. It will thicken and develop as your pregnancy progresses, but will continue to be almost transparent for quite some time. And here's the skinny on baby skin, it's practically translucent now, so if you took a peek inside your uterus, you'd be able to see your baby's blood vessels under that thin skin. Scalp patterning. On your baby's scalp, hair follicles are forming a pattern that will remain for life. This patterning sets the stage for how your baby's hair will grow. New hair follicles don't form after birth, so babies are born with all the hair follicles they'll ever have. Heart at work. Your baby's heart is now pumping about 25 quarts of blood each day, and this amount will continue to increase as your little one develops. Baby will soon hear your voice. Listen up, tiny bones in your fetus ears are in place, making it likely that baby will soon be able to hear your voice, or something like it, when you're speaking. Generally, babies fully develop the ability to hear in the womb by 18 weeks of pregnancy. During its 16th week of development, a fetus will be starting to form facial expressions, and its nervous system will be growing. Your body at week 16. Rapid growth. At 16 weeks pregnant, your uterus is growing at about the same pace as your baby's. It's getting to the point where you may not be able to hide your pregnancy anymore, even if you wanted to. Your 16 weeks pregnant belly. At 16 weeks pregnant, you may now be at the stage where your bump clearly has a baby in there. Your pregnancy weight gain. It may be hard to watch yourself gain weight during pregnancy, even when you know there's a wonderful reason for it, but try to embrace your body's new shape and think of every pound you put on as a sign of good health for you and your baby. Nasal congestion. 16 weeks pregnant, your symptoms. At 16 weeks pregnant, here are some of the symptoms you may be experiencing. Skin changes. You might have heard about the pregnancy glow, and now it might be your turn to experience it. Increased blood volume in the blood vessels and pregnancy hormones causing more oil production can make pregnant skin look flushed and dewy. Nosebleeds. At 16 weeks pregnant, nosebleeds can be an issue for some moms-to-be, and might be caused by increased circulation and higher levels of hormones. Lower back pain. This is one of the most common symptoms that can strike when you're pregnant, and it's good to have some strategies to avoid or lessen the discomfort. For example, take warm baths or showers, stretch regularly to help your hardworking back muscles relax, pay attention to your posture, and wear low-heeled shoes. Dizziness. Round ligament pain. As your amazing uterus grows, the round ligaments that support it are thickening and stretching. Breast changes. Pregnancy headaches.
"17 weeks baby development. How big is your baby at 17 weeks pregnant?" The baby is around 5.1 inches this stage. This is roughly the size of a potato. The skin is loose and wrinkled and the fetus has a lot of growing to do. By the time of the delivery, he or she will fill out their skin more normally. Around this stage of pregnancy, the fetus starts to look a lot more human. In addition to hair growing on the head, the eyebrows and eyelashes are also developing. The eyelids are shut, but the eyes themselves can move and the mouth can also open and close. The fingernails and toenails are growing, and your bundle of joy has also developed a firm grip. Your baby's been getting bigger and bigger over the last couple of weeks, and this means that he or she has needed a larger placenta. Remember that the placenta is the organ that supplies nutrition to the fetus, removes waste products, and fulfills other important roles. By the end of your pregnancy, the placenta will weigh around 510 grams. Your baby now has doubled in weight in the last 2 weeks. Fat begins to form, helping your baby's heat production and metabolism. The lungs are beginning to exhale amniotic fluid, and the circulatory and urinary systems are working. Your baby's bones. Your baby's skeleton is changing from soft cartilage to bone. Support your baby's bone health, and your own, by eating calcium-rich foods. Getting enough calcium also reduces your risk of hypertension and preeclampsia. The umbilical cord. The umbilical cord, your baby's lifeline to the placenta, is growing stronger and thicker. By the end of pregnancy, it will be approximately 9 inches long and an inch thick. The umbilical cord delivers nutrients to your baby and ferries away waste products. Your baby's skin. Sweat glands are starting to develop. And by next week, the layers of your baby's skin will be fully formed. Your baby when you're 17 weeks pregnant. Your baby is getting bigger all the time and might now weigh more than the placenta. Your baby is about 13 centimeters from head to bottom and about 150 grams. Your baby's external sex organs are completely formed. The kidneys are working, and your baby passes urine every 50 minutes or so. Your baby will also swallow some urine, which is sterile, in the amniotic fluid. This is normal. Loud noises might make your baby startle. Your baby's taste buds are working, and your baby can tell the difference between sweet and bitter. What does my baby look like? Your baby, or fetus, is around 12 centimeters long, from head to bottom, and weighs around 150 grams. That's roughly the size of a pomegranate and the weight of a ball of mozzarella. Your baby can move their eyes, although they'll stay shut for now. React to loud noises, open and close their mouth. Your baby's fingernails are starting to grow and will have their own unique fingerprints. Even identical twins have different fingerprints. Week 17, your second trimester. You might start to feel your baby move now. You will not be able to tell exactly what your baby's up to, but soon you could be feeling every kick, punch, hiccup and somersault. Your baby's movements. Many women spot the first signs of their baby moving between 18 and 24 weeks. Inside your tummy, you might feel bubbling, fluttering, rolling. You might find that your baby moves more after meals, when you listen to loud music, when you rub your tummy and talk to your baby, when you are relaxing. Here are some of the other symptoms you may be experiencing: tiredness and difficulty sleeping, swollen or bleeding gums, pain on the side of your belly, headaches, nosebleeds, bloating or constipation, indigestion.
Pregnancy week 1 to 2. 1 and 2 weeks pregnant. Congratulations! During the first and second week of pregnancy, your body is preparing for possible conception. How is pregnancy calculated? Calculating the day your baby begins to develop and keeping track of your pregnancy dates can be a challenge. The development of pregnancy is counted from the first day of the woman's last normal menstrual period, LMP, even though the development of the fetus does not begin until conception, which is about 2 weeks later. Pregnancy is calculated from this day because each time a woman has a period, her body is preparing for pregnancy. Counting from the LMP, most women are pregnant an average of 280 days. Calculating from the LMP also gives a standard of measurement for healthcare providers to follow, since it is extremely difficult to know exactly when conception occurred. For more information on how pregnancy is measured, please see our information on calculating your dates.
What changes are occurring with your body? Your period has just begun, and you may be thinking about becoming pregnant. Your ovulation time is the most important thing you need to understand when trying to conceive. Ovulation occurs when a mature egg is released from the ovary, pushed down the fallopian tube, and available to be fertilized. The lining of the uterus has thickened to prepare for a fertilized egg. If conception does not occur, the uterine lining will be shed. The shedding of an unfertilized egg and the uterine wall occurs during menstruation. There are also several facts that you need to know concerning ovulation. An egg lives 12 to 24 hours after leaving the ovary. Normally, only one egg is released each time you ovulate. Ovulation can be affected by stress, illness, travel, and significant changes in weight, exercise, and sleeping patterns. Some women may experience light spotting during ovulation. This is not considered to be an actual period, but rather an ovulatory bleeding. What is happening with your baby? Nothing is happening yet, but be patient while the stage is being set. Before long, an egg will be released and will be available to be fertilized. How do you track ovulation? A woman's monthly cycle is measured from the first day of her menstrual period until the first day of her next period. On average, a woman's cycle normally is between 28 to 32 days. Ovulation is calculated by starting with the first day of the cycle, which is the day the menstrual period begins. Most women ovulate on any one day between day 11, day 21 of their cycle. This is what many refer to as the fertile time or fertility window of a woman's cycle because sexual intercourse during this time increases the chance of pregnancy. For more information on tracking ovulation, please see Fertility Awareness, Understanding Ovulation, Ovulation Calendar. What should you plan at this time? There may need to be some lifestyle changes made at this time to increase your chances of conceiving and having a healthy baby down the road. Adequate exercise and a balanced diet are important factors to evaluate. It is recommended to begin taking prenatal vitamins and stop using substances such as caffeine, artificial sweeteners, alcohol, recreational drugs, nicotine. If you are taking prescription drugs, check with your healthcare provider to see if such medication is safe to take during pregnancy. For more information on nutrition during pregnancy, please see our information on preconception nutrition. Tips for making your pregnancy better. The most important thing you can do right now is to act in the way you would if you already knew you were pregnant. Since it can be weeks before you know if conception has occurred, this will protect both you and your future baby from any substances or activities that could cause problems.
3 weeks pregnant. Sperm met egg last week, and voila, you've made a baby. It's so early that when you're 3 weeks pregnant, you may have no idea that you're actually pregnant. Conception just happened a few days ago, and there probably hasn't been time for you to miss a period yet at week 3 of pregnancy. Can you tell you're pregnant at 3 weeks? While some people feel no difference at all at this early stage, others may start to notice 3 weeks pregnant symptoms. The experience at 3 weeks pregnant can really vary, so don't fret if you don't feel anything out of the ordinary. However, if you feel nauseous and your breasts are sore, that's normal too. Everything changes quickly in early pregnancy, so no matter how you feel, be prepared to feel different in a week. 3 weeks pregnant symptoms. When you're 3 weeks pregnant, symptoms may not have appeared yet. That's because most early pregnancy symptoms are caused by pregnancy hormones. Spotting as the fertilized egg burrows into the lining of your uterus. Nausea. As the pregnancy hormone HCG begins to make its way through your newly pregnant body, you may notice some feelings of queasiness, or nausea so bad it makes you puke. Morning sickness should really be called all-day sickness since it doesn't discriminate by time of day. If you're feeling this symptom of pregnancy at 3 weeks, you may be further along than you thought, or you may even be 3 weeks pregnant with twins. That's because twin moms-to-be often have higher levels of pregnancy hormones and therefore worse nausea. Breast changes. Your breasts can start to get sore and your nipples may darken as your body starts prepping to make milk. Missed period. If your cycle is typically shorter than 28 days, you may realize toward the end of this week that you could be pregnant. The only way to know for sure is to take a pregnancy test. Positive home pregnancy test. Check the box of your home pregnancy test to see how accurate its results are before your missed period. Most are over 99% accurate once you've missed it, and some brands promise to detect pregnancy hormones in your urine sooner than that. For example, when you're 3 weeks 5 days pregnant or even 3 weeks 4 days pregnant. Here's the thing, the amount of pregnancy hormone HCG in your body might not be enough for the test to detect right away, but it doubles every 48 hours. If you get a negative result, follow up a few days and then a week later with another pregnancy test and then another, to be sure it wasn't just too early to tell. Positive blood pregnancy test. In some cases, like if you're at risk for miscarriage or ectopic pregnancy, your doctor may ask you to come into the office for a blood draw. Blood tests can detect smaller amounts of HCG than urine tests can, so you may find out that you're pregnant. 3 weeks, pregnant belly. A belly isn't really a thing. Though you may feel a bit bloated, most pregnant women don't start to show until around week 12 or later. Before you start eating for 2, know that doctors only recommend most women gain 1 to 5 pounds total in the first trimester, that's the first 13 weeks. So you definitely don't have license to start indulging at 3 weeks pregnant. In fact, try to eat a healthy, well-rounded diet and to take a daily prenatal vitamin with at least 400 micrograms of folic acid in it. Doctors don't recommend increasing your daily calorie intake until the second trimester. Once you hit week 14, you'll want to add about 300 calories per day.
During week 4, the tiny life you and your partner created just a week ago is implanting and settling into its new home in your uterus, where it will grow and develop over the next 36 weeks. Along with implantation, comes a rise in the pregnancy hormone HCG. At the end of this week, there may be enough HCG to detect with a sensitive early home pregnancy test. First, what is your baby's due date? Your baby's development at 4 weeks. Starting at week 4, your baby is called an embryo. At just 0.2 millimeters, your little embryo is about the size of a poppy seed. Implantation. When the fertilized egg is in the uterus and attaches to the uterine wall, it is called implantation. Implantation usually takes place 6 to 10 days after ovulation. So, if it didn't happen at the end of week 3, your budding baby will burrow into your uterine lining this week. Early development. There inside your fertilized egg are all the cells that will develop into your baby and what your baby needs to survive for the next 9 months. The inner cells begin to transform into your baby's organs and body parts. The outer cells start to form the placenta. You and your baby at 4 weeks pregnant. Your baby at 4 weeks. In weeks 4 to 5 of early pregnancy, the embryo grows and develops within the lining of your womb. The outer cells reach out to form links with your blood supply. The inner cells form into 2, and then later into 3 layers. Each of these layers will grow to be different parts of your baby's body. The inner layer becomes the breathing and digestive systems, including the lungs, stomach, gut, and bladder. The middle layer becomes the heart, blood vessels, muscles, and bones. The outer layer becomes the brain and nervous system, the eye lenses, tooth enamel, skin, and nails. In these early weeks of pregnancy, the embryo is attached to a tiny yolk sac that provides nourishment. A few weeks later, the placenta will be fully formed and take over the transfer of nutrients to the embryo. The embryo is surrounded by fluid inside the amniotic sac. It's the outer layer of this sac that develops into the placenta. Cells from the placenta grow deep into the wall of the womb, establishing a rich blood supply. This ensures the baby receives all the oxygen and nutrients it needs. You at 4 weeks. Conception usually takes place about 2 weeks after your last period, around the time you release an egg, ovulate. In the first 4 weeks of pregnancy, you probably will not notice any symptoms. The first thing you may notice is that your period does not arrive, or you may have other signs and symptoms of pregnancy, such as breast tenderness. You can confirm the pregnancy with a pregnancy test.
5 weeks pregnant symptoms. Pregnancy symptoms are unique and unpredictable. 2 people can each have healthy pregnancies without any of the same symptoms. Likewise, you may have bad nausea in your first pregnancy, but no morning sickness in a later pregnancy. The swiftly rising levels of the hormones human chorionic gonadotropin, HCG, and progesterone are responsible for many of the pregnancy symptoms you experience. You can expect any of the following week 5 pregnancy symptoms. 1. Morning sickness. Don't be fooled by the word morning. Nausea and vomiting can happen at any time during the day. While morning sickness typically begins during week 6 of pregnancy, some people experience it earlier. Eating several small meals throughout the day, instead of 2 or 3 big meals, may help to relieve these symptoms. Call your doctor if you can't keep any food or liquid down. This may be a sign of hyperemesis gravidarum, which is a rare disorder that involves continual nausea and vomiting during pregnancy. It sometimes requires inpatient treatment at a hospital. 2. Lightheadedness. Your blood pressure tends to run lower than usual during pregnancy. This can cause dizziness and even fainting. If you feel dizzy, sit down if you're standing or pull over if you're driving. 3. Frequent urination. As your uterus expands, it can press against your bladder. This will likely cause you to need to urinate more frequently. Go when you have the urge so that you avoid bladder infections. Drink plenty of water to avoid becoming dehydrated. 4. Abdominal cramps. You may experience mild cramping or bloating. This can be caused by the egg implanting or from your uterus stretching. While mild cramping shouldn't cause alarm, contact your doctor immediately if you experience severe pain that doesn't go away. 5. Vaginal bleeding. Light bleeding, also known as spotting, around the time of your missed period is usually considered implantation bleeding. While spotting can be caused by many factors, always let your doctor know if you notice any spotting or bleeding at any time during pregnancy. 6. Fatigue. As your progesterone levels increase, you may find yourself feeling sleepy and losing energy. Fatigue is most common during the first trimester, but some people will experience fatigue throughout their pregnancy. 7. Breast changes. You may experience tender, sore, swollen, or fuller breasts as your hormone levels change. This is one of the earliest symptoms of pregnancy and may appear soon after conception. 8. Food cravings and aversions. Your changing hormones can lead to a change in your appetite. You may find yourself avoiding foods you used to enjoy, or you may start craving foods you don't commonly eat. You can begin experiencing food cravings and aversions early on in your pregnancy. 9. Constipation. Your food will start moving more slowly through your digestive system to give nutrients more time to be absorbed into your bloodstream and reach your baby. This delayed transit can lead to constipation. Eating more fiber and drinking lots of fluids can help relieve or eliminate constipation. 10. Increased vaginal discharge. Vaginal discharge during pregnancy may be expected. It should be thin, white, milky, and mild smelling. If the discharge is green or yellowish, has a strong smell, or is accompanied by redness or itching, you should contact your doctor. This is likely a sign of a vaginal infection. 11. Mood swings. Pregnancy can cause a lot of emotions. Not only can the idea of a new baby cause emotional stress, but the changes in your hormones can also affect your emotions. It's perfectly fine to feel a variety of emotions from day to day, such as elation, sadness, anxiety, fear, and exhaustion. If these feelings are extreme or last more than a few days, consult your doctor right away. Warning signs of a miscarriage. According to the American College of Obstetricians and Gynecologists, about 10% of pregnancies end in miscarriage. Signs of a miscarriage include vaginal bleeding, the most common sign, which tends to be heavier than spotting and may contain clots. Abdominal or pelvic cramps. Back pain. Call your doctor if you experience any bleeding during pregnancy. An ectopic or a tubulate pregnancy is a pregnancy that grows outside the uterus, most often in the fallopian tube. This type of pregnancy isn't viable and can be life-threatening to the birthing parent. Symptoms of an ectopic pregnancy include vaginal bleeding, pelvic pain or cramping, possibly on one side, shoulder pain, dizziness or fainting. Call your doctor right away if you feel as though you are having symptoms of an ectopic pregnancy. Your baby development. The 5th week of pregnancy marks the start of the embryonic period. This is when baby's body systems and structures begin to form, such as the heart, brain, and spinal cord. Your baby's heart beats at a steady rate now, though it may not be detected by ultrasound for another 1 or 2 weeks. The placenta is also starting to develop. At this stage, your baby doesn't look like a baby yet. The embryo is growing quickly, but it's still very small, about the size of a pen tip or a sesame seed. Around this time, baby initially measures just 2 to 3 millimeters. Your body is gearing up to go through big changes, too. Pregnancy hormone levels are rapidly rising, and your uterus will begin to grow. You won't look pregnant for a couple more months, but you may start to experience symptoms now. Twin development at week 5. If you're carrying multiples, you may be able to detect your babies through an early ultrasound during week 5. Your babies are measured in millimeters at this point, but you might see 2 gestational sacs or even a couple of tiny fetal poles as the week goes on. Occasionally, you'll detect 2 gestational sacs at this early stage, but only 1 baby at a later ultrasound. This is called vanishing twin syndrome. There's often no clear reason for the loss, per 2021 research. You may have cramping and bleeding, or you may have no symptoms at all.
6 weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Mom's body at 6 weeks pregnant. This week, your breasts may feel tender or achy because of increased blood flow. This is a normal part of your body preparing for breastfeeding. Wearing a supportive bra can help with discomfort. You may also experience constipation because of an increase in progesterone, which slows down the digestive tract. To deal with this, exercise regularly, eat a balanced diet with high-fiber foods, and drink plenty of water. 6 weeks pregnant, your symptoms. At 6 weeks pregnant, here are some of the symptoms you may be experiencing. Spotting. It's not unusual to see some spotting at 6 weeks, but it should be light, not even enough to cover a small pantoliner. This implantation bleeding is normal, but if you see a lot of blood, if the spotting lasts longer than 2 days, or you have any concerns, be sure to see your doctor right away. Cramping. At 6 weeks pregnant, slight cramping can be normal. It's a sign your uterus and the surrounding tissues are expanding to make room for your baby. If you feel pain more severe than usual period cramping, especially if accompanied by a fever or diarrhea, contact your doctor immediately. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help, so keep a little something on hand for those random bouts of nausea. Exhaustion. You may feel completely exhausted due to pregnancy fatigue, and that's okay. As your levels of the pregnancy hormone progesterone are increasing, making you more and more tired, you may find taking naps can help. Some women also say that little snacks and some light exercise are effective in fighting off fatigue. Ways to help yourself feel a bit better. No symptoms. That's right, it's possible to be 6 weeks pregnant with no symptoms whatsoever. Every pregnancy and every woman is different. For example, some women never experience morning sickness, so if you're one of the lucky few, enjoy these nausea-free days without worry. 7 weeks pregnant, your baby's development. Although your baby's brain development will continue long after birth, the basic sections have formed. As the week progresses, the digestive system and lungs are also developing. Tiny facial features are also starting to take shape, and each little arm now has a paddle-shaped hand attached to it. Another important development this week is the formation of the umbilical cord. This cord creates a connection between you and your developing baby throughout your pregnancy that allows nutrients and oxygen to flow between you and also eliminates your baby's waste. If you have a prenatal checkup scheduled for this week or sometime soon, and have an ultrasound exam, you may have an opportunity to see and hear something amazing, a heartbeat. Don't worry if this isn't in your healthcare provider's plans quite yet. The size of the embryo at 7 weeks pregnant. Your little one is growing fast. At 7 weeks, the embryo is about the size of a small blueberry, about 0.3 inch long. For a visual idea of how things are developing inside your uterus this week, check out this illustration: placenta, yolk sac, embryo, amniotic sac, uterus, cervix. Mom's body at 7 weeks pregnant. The pregnancy signs and symptoms you may have experienced in the past weeks will probably continue, and some of them may become more pronounced this week. Although these symptoms can be tiring and annoying, keep in mind that you're just a few weeks away from your second trimester, when many of these symptoms may subside. One symptom you may be experiencing around this week of pregnancy is frequent urination. Hormonal changes and increased blood volume are to blame for this. Now that there's more fluid in your system, it means more for your kidneys to process, and as a result, more urine is produced. 7 weeks pregnant, your symptoms. At 7 weeks pregnant, here are some of the symptoms you may be experiencing. Excess salivation. You may notice more saliva than usual, often accompanying the nausea and vomiting of morning sickness. It may feel weird, but this is just another strange, yet normal part of pregnancy for many women. Food cravings or aversions. Feel like pickles and chocolate for dinner? Can't stand the smell of eggs even though it never used to bother you? Your food preferences and tolerance for odors may change during this time, and these changes are most likely caused by hormones. If you find yourself craving any non-food items, like dirt or chalk, talk to your healthcare provider right away. Nausea. Of all of this week's symptoms, morning sickness can be the worst. It's often in full effect at this stage, and it can make you feel absolutely miserable. Luckily, for many women it's likely to disappear during the second trimester. Diarrhea. As if you needed another trip to the bathroom at 7 weeks, diarrhea is usually nothing to worry about. It may be one of the gastrointestinal symptoms, like constipation or indigestion, that you might experience due to fluctuating hormones. Try adding foods like applesauce, oatmeal, and bananas to your diet to help absorb any excess water, and stay hydrated, as diarrhea can lead to dehydration. Spotting. Light spotting at 7 weeks pregnant is considered normal, especially after sex. If you notice heavy or bleeding, call your healthcare provider. Cramping. If you feel mild cramps, what you're experiencing is quite normal. Your uterus is expanding, so some discomfort is to be expected. If the cramping is severe or long-lasting, or if you feel pain other than cramping, call your healthcare provider. Fatigue. You may continue to feel exhausted this week. Your levels of the hormone progesterone are quickly increasing, and it's this hormone that can make you feel sleepy.
8 weeks pregnant, your baby's development. This week, hands and feet are forming tiny fingers and toes, and those arms are able to flex at the elbows and wrists. At this point, eyes begin to develop pigment, and genitals are forming too, although it's still too soon to know whether you're expecting a boy or a girl. If you feel like taking a guess though, have some fun with our baby gender quiz. These external features aren't the only things developing, the internal organs are making strides. As the intestines form, they start to take up space in the umbilical cord because there's not enough room in your baby's abdomen yet. Even at this early stage, the intestines are working to carry waste away from the body. A month from now, when there's more room in your little one's belly, the intestines will move out of the cord and back into the abdomen. The size of the embryo at 8 weeks pregnant. Your baby has already come a long way, and soon, growth will speed right up. Your little one is about the size of a raspberry this week, just 0.5 to 0.6 inch long, crown to rump. Mom's body at 8 weeks pregnant. By the time you're 8 weeks pregnant, pregnancy symptoms will be in full swing. Your clothes may start to pinch a little, but on the plus side, you may be able to hear your baby's heartbeat for the first time, something to make up for the not-so-pleasant symptoms you may have been experiencing. You may be wondering when you will start showing. 8 weeks pregnant, your symptoms. At 8 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You may be dealing with nausea and even vomiting right about now. The good news is morning sickness symptoms usually subside during the second trimester, and you're almost there. For now, try nibbling on crackers before you get up, and aim for 5 or 6 small meals a day, rather than 3 large ones. Food and smell aversions. Certain tastes and odors that have never bothered you before may seem overbearing or repugnant, thanks to increased hormones that amplify your sense of smell and make your stomach feel as if you're on a wild roller coaster ride. Diarrhea. Your digestive system may be far more sensitive now. Make sure you're practicing healthy eating habits and staying hydrated. Contact your healthcare provider if the diarrhea lasts longer than 24 hours. Or is accompanied by any other symptoms, and do not take anti-diarrheal medicine or any medication before checking with your provider. Frequent urination. Yes, you may still be making lots of extra trips to the bathroom. This symptom will come and go throughout the rest of your pregnancy as your baby grows and your uterus expands, both of which put pressure on your bladder. Abdominal cramping. This symptom can be associated with the continued growth of your uterus. Back pain. By the time you are 8 weeks pregnant, back pain may strike, particularly around the lower back. That's because the muscles in your back are working a bit harder than usual as your weight is redistributed to accommodate your growing uterus. Furthermore, your center of gravity is changing, and those pregnancy hormones are working on relaxing ligaments in the joints of your pelvis. Light spotting. Spotting, a few drops of blood at a time, can be normal. However, be sure to talk to your healthcare provider if you feel at all concerned and call right away if you notice heavier bleeding. Fatigue. Your progesterone levels are increasing, which can often leave you feeling more tired than usual. Go ahead and grab some extra snooze time whenever you can. If you're feeling exhausted, listen to your body and try to take it easy. Trouble sleeping. Changing hormone levels, discomfort, and extra trips to the restroom often add up to disturbed sleep. Try listening to peaceful music or reading a book if you're feeling wide awake. You can also try drinking warm milk or taking a shower or bath before bed. Some women find lying on their left side is helpful as it improves blood circulation. Placing a pillow between your knees may help you feel more comfortable too. 9 weeks pregnant. Your baby's development. This week, your little one, now officially known as a fetus, is looking less and less like a little pink blob and instead has more of a mini baby shape. Even the tail that had been present in earlier weeks has almost disappeared. Tiny facial features continue to develop this week, including a more prominent nose and eyelids. Up top, the head is large compared to the body, while down below, little toes are now visible. Internal organs are also forming, including the digestive and reproductive systems, meaning that the intestines as well as testes or ovaries are growing. Now that you're 9 weeks pregnant, your little one may be starting to move, thanks to some recent muscle development. But you'll have to wait until sometime in the second trimester to actually feel these movements. The size of the fetus at 9 weeks pregnant. At 9 weeks, the fetus is about the size of a cherry. Your little one may now measure 0.6 to 0.7 inch long and weigh about 0.12 ounce. Mom's body at 9 weeks pregnant. Symptoms at 9 weeks pregnant may include changes to your breasts. They are probably fuller, heavier, and tender to the touch due to the enlargement of your milk glands and an increase in fatty tissue. Although your breasts will likely continue to grow throughout your pregnancy, the sensitivity will usually subside once your body adjusts to the surge of pregnancy hormones. 9 weeks pregnant, your symptoms. At 9 weeks pregnant, here are some of the symptoms you may be experiencing. Growing waistline. Your belly at 9 weeks pregnant may not have a pronounced, rounded look, but your pre-pregnancy clothes are probably feeling a little snug due to a combination of a thickening waistline and some bloating brought on by your old friends, pregnancy hormones. Spotting. You may see some spotting in the first trimester. Call your healthcare provider if you see any more than a few drops of blood. Mild uterine cramping. This is a time of rapid change in your body, and you may experience mild uterine cramping. If the cramping is severe, or if you feel other pain like lower back pain, call your doctor to rule out any problems. Morning sickness. If you haven't experienced morning sickness by now, you could be one of the lucky ones who will avoid this common symptom. But if you do get morning sickness, keep on eating smaller meals frequently throughout the day and remember to stay hydrated. Being hungrier. You may start to feel a bit hungrier than usual, so munch on some extra snacks, keeping in mind that you only need to add about 300 calories to your daily intake. Foods like fruit, cereal, and yogurt are great choices. Food cravings and aversions. Your sense of smell is heightened now, and foods and smells you once enjoyed may now seem unpleasant. On the flip side, you may now find you crave certain foods. You can feel free to indulge any food cravings you have, as long as they seem healthy. Just make sure you're sticking to a balanced diet. Always talk to your healthcare provider if you crave non-food things like dirt or chalk. Fatigue. Thanks to an increase in your levels of the hormone progesterone during the first trimester, you may find yourself sleepier than usual. Rest as much as you can during the day, particularly if you're having trouble sleeping at night. Feeling moody. If you're feeling on top of the world one minute and doomed the next, you can thank pregnancy hormonal changes. Speak to loved ones about how you're feeling. It may help you feel a little better, and seek help from your healthcare provider if your mood swings are severe. Frequent urination. Yes, those extra trips to the bathroom may still be a part of your day as your baby grows and your uterus presses against your bladder. This need to pee more often may also be caused by the increased volume of blood in your body, which makes your kidneys work overtime. Don't drink less water, as staying hydrated is important, but try to go to the restroom before you head out the door or before you go into a long meeting. If you notice a burning sensation or pain when you pass urine, call your doctor, because this can be a sign of a urinary tract infection. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. Read up on how you can combat some of those spots and blemishes, and remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born. "10 weeks pregnant. Your baby's development. Your baby has come a long way in just a few short weeks. That little head is taking on a rounder, more human shape, and by now all the internal organs should be in place and starting to work together. Tiny tooth buds have begun to develop too. Your baby's fingers and toes are growing longer, and the webs that had been between each finger and toe are starting to disappear. At the moment, your baby's eyes, eyelids, and ears are continuing to develop, but they've still got some growing to do before they're fully formed. The size of the fetus at 10 weeks pregnant. Your little one is still growing very quickly. At 10 weeks, the average fetus is about the size of a strawberry, measuring approximately an inch from crown to rump. Mom's body at 10 weeks pregnant. Your uterus is about the size of a large orange at this point, whereas before you became pregnant it was about the size of a small pear. Around this time, you likely have had or will soon have a visit with your healthcare provider for a thorough examination. At this appointment, your provider may do an internal and external abdominal exam to determine the size and position of your baby, as well as take blood samples for a variety of other tests. Used to determine if you have any infections, what your blood type and Rh factor are, and whether your own immunizations are up to date. 10 weeks pregnant, your symptoms. At 10 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You're not alone if you're 10 weeks pregnant and you're still suffering from morning sickness. The good news? You're likely to start feeling better soon. Morning sickness often goes away after you enter the second trimester. Keep in mind, some moms-to-be experience a more severe form of morning sickness called hyperemesis gravidarum. If you suspect you may have this, speak to your healthcare provider. Round ligament pain. Of all of the pregnancy symptoms you may be experiencing around this time, this one is among the most uncomfortable. Round ligaments are two of the ligaments in your pelvis that help support the uterus, and as your baby grows during pregnancy they stretch and soften. When these ligaments tighten, you may feel pain on one or both sides of your abdomen. Changing positions in bed or doing strenuous exercise may bring on this pain. Light stretching and gentle movements may help relieve the discomfort. If this symptom doesn't go away on its own, or if you also have a fever, call your healthcare provider. Minimal weight gain. Even though your clothes may be fitting a bit tighter, you may not have gained much weight, and you may even have lost a little if you've been dealing with morning sickness. Be sure to talk to your doctor if you're concerned. Exhaustion. You might feel like napping at every opportunity. This could be thanks to the increased levels of the hormone progesterone in your body. Headaches. Some moms-to-be get the occasional headache during pregnancy. If you're experiencing this symptom, try to rest in a darkened room and apply an ice pack to your head or neck to help relieve the pain. Contact your healthcare provider if the headache persists or is severe. Mood swings. Hormonal changes may play a role in the highs and lows you feel when you're about 10 weeks pregnant. You may find it helpful to distract yourself by chatting with friends, watching funny TV shows or movies, or treating yourself to a massage. Just be sure to choose a trained masseuse who knows about safe massage techniques for pregnant women. Vaginal discharge. You might be seeing more vaginal discharge than before, which is caused by your increased blood supply and higher hormone levels. This normal vaginal discharge is known as leukorrhea, and you can expect to see a clear to milky colored, nearly odorless discharge that may appear slightly yellowish on your underwear. Contact your healthcare provider, though, if you notice a strong odor or color changes, or if you experience itching or bleeding around the vaginal area. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. And remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
11 weeks pregnant, your baby's development. From an oversized head to tiny tooth buds, this week is full of exciting growth and changes, both big and small. Your baby's facial features are slowly maturing, with the ears now moving toward their final position on the sides of the head, and the eyes set wide apart with eyelids fused shut. Genitals are forming too, although it's still too early for your healthcare provider to tell if you're having a girl or a boy. But even though you don't know your baby's gender yet, why not start a list of your favorite baby names for boys and girls? Have some fun with our baby name generator. You still have plenty of time to browse and find a name you love. Tiny buds that will eventually become teeth are developing. The head makes up half the total body length at this stage, although in the coming weeks the body will grow significantly too. To support all this growing, your baby now needs more nutrients, so the placenta grows, and its red blood cells increase in number to meet this need. The size of the fetus at 11 weeks pregnant. At 11 weeks, the fetus is about the size of a Brussels sprout. From crown to rump, the average length is now 2 inches, and the average fetus weighs just about 0.33 ounce. Mom's body at 11 weeks pregnant. Are you having unusual food cravings this week? They're quite common. Between 50 and 90% of women experience these cravings at some point during pregnancy. No one knows for sure why pregnancy cravings occur. Some medical experts believe these cravings are your body's way of telling you what it needs, while others blame them on changing hormone levels. As long as your food choices are part of a healthy pregnancy diet, go ahead and eat up. There is a type of craving that needs medical attention. However, if you crave non-food items like clay or dirt, contact your healthcare provider. 11 weeks pregnant, your symptoms. At 11 weeks pregnant, here are some of the symptoms you may be experiencing. Breast growth. Your breasts may be a little larger now, and you can expect to see even more growth as your pregnancy progresses. Some of this may be because the milk glands grow in preparation for breastfeeding. You might gain up to 3 pounds of breast tissue over the course of your pregnancy. Increased vaginal discharge. Your body may be releasing more clear vaginal discharge now. This is normal as long as it is odorless and clear or white in color. If you notice changes including blood, itchiness, or a foul odor, contact your healthcare provider to rule out problems. Dark abdominal line. You might notice you have developed a long, dark line that runs vertically down the center of your belly. It's called the linea nigra, or the pregnancy line, and it's thought to be associated with hormonal changes. This line will likely fade after your baby's birth. Leg cramps. You may be troubled by tight, painful leg cramps, particularly at night. This can make it tough to get a good night's rest. Stretching can help with leg cramps, as can exercise. In some cases, mineral depletion may contribute to having leg cramps, so make sure that your diet is giving you enough calcium and magnesium, and take care to stay hydrated. Fatigue. Right now, your levels of the pregnancy hormone progesterone are increasing, which can sometimes make you sleepy when you'd rather be alert. And if you've been waking to pee or having leg cramps or getting heartburn during the night, your sleep may be suffering too. Eliminating caffeine and following a relaxing bedtime ritual every evening can help fight pregnancy fatigue. Mood swings. You can thank your heightened hormone levels if you've been experiencing mood swings or moodiness lately. Try to avoid stress, and ensure you're getting enough iron in your diet. Practicing yoga, doing simple meditations, or relaxing while listening to soft music might help you feel a little better. You could also ask your healthcare provider for advice on dealing with your mood swings, particularly if they're interfering with your daily life. Morning sickness. You might experience queasiness and even vomiting at 11 weeks pregnant, and this can occur at any time of day. Morning sickness often subsides in the second trimester, though, and you're almost there. Baby development at 12 weeks. Your baby is about the size of a lime. Length: 2.13 inches. Weight: 2.05 ounces. Small movements. This week, your baby can open and close their hands, making a fist, and curl their toes. Tiny fingernails. Your baby has itsy bitsy nails growing on their fingers and toes. Your baby's intestines. The stomach and esophagus started forming around 7 weeks of pregnancy, and your baby's intestines grew so fast that they protruded into the umbilical cord. Soon, the abdominal wall will close and their intestines will make their way inside their abdomen. Your baby, although tiny, is now fully formed. They are about the size of a plum. The placenta is also now fully formed, although it will keep growing throughout your pregnancy. The placenta is your baby's life support system, passing oxygen, nutrients, and antibodies from your blood supply to your baby. From now on, your baby is going to grow, grow, grow. Even though you can't feel it yet, your baby is moving, waving, and dancing. They can also swallow. Your 12-week fetus is almost done developing their body's important systems and parts, which means it's all about getting bigger and more mature from here on out. Yep, baby's about to enter the growth and maturation stage, in which organs and tissues will grow and develop rapidly. Baby at 12 weeks is opening and closing their fingers and curling their toes, and their brain is developing fast. Baby is now developing reflexes. If you poke your 12-week pregnant belly while looking at baby on an ultrasound, you'll likely see movement. If you're 12 weeks pregnant with twins, your twosome is developing at a similar rate as singleton babies at 12 weeks. Later on, they'll have a slightly slower rate of growth. Early pregnancy symptoms at 12 weeks. Your signs of pregnancy may include an aching stomach, nausea, mood swings, a metallic taste in your mouth, sore breasts, indigestion and heartburn, headaches, dizziness, new likes and dislikes for food and drink, a heightened sense of smell, a white milky pregnancy discharge from your vagina, light spotting, see your doctor if you get bleeding in pregnancy, cramping, a bit like period pains, darkened skin on your face or brown patches, this is known as chloasma or the mask of pregnancy. Greasier, spotty skin. Thicker and shinier hair. Bloating and the feeling of being bloated.
Hello everyone, and welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. At this stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional support and counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider for advice and guidance. So that's it for this week's video on pregnancy symptoms and baby development at 27 weeks. Thanks for tuning in, and we'll see you in next video. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's talk about some common symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Heartburn and indigestion are also common during the third trimester as your growing uterus puts pressure on your stomach, leading to acid reflux. Eating small, frequent meals and avoiding spicy or acidic foods can help alleviate these symptoms. Now let's talk about your baby's development at 28 weeks. At this stage, your baby weighs around 2.5 pounds and is approximately 15 inches long. Their brain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs expand and contract. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, and they can now hear your voice and your heartbeat. You may notice that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the third trimester, they will be able to hiccup. So, what can you expect during the rest of the third trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. You may also notice an increase in vaginal discharge, which is normal but should not have a strong odor or be accompanied by itching or burning. It is also important to start preparing for labor and delivery. Talk with your healthcare provider about your birth plan and attend childbirth education classes to learn about the different stages of labor and coping techniques for pain. In summary, at 28 weeks pregnant, you may experience symptoms such as fatigue, shortness of breath, and swelling. Your baby is rapidly growing and developing, and they can now hear your voice and blink their eyes. As you move into the third trimester, be sure to continue monitoring your symptoms and preparing for labor and delivery. That's all for today's video. Thank you for watching, and be sure to subscribe to our channel for more pregnancy updates.
Hello, and welcome back to our pregnancy journey. Today we're going to talk about the 29th week of pregnancy and what you can expect for both your baby's development and your own body changes. Let's start with your baby. At this point, your little one is roughly the size of a butternut squash, weighing in at around 2.5 pounds and measuring about 15 inches long from head to toe. Your baby's brain is continuing to develop rapidly, and their lungs are starting to produce surfactant, a substance that helps them breathe on their own outside of the womb. Your baby's movements are becoming more pronounced, and you may start to notice a pattern of when they are most active. They are also starting to develop their sense of taste and can taste the amniotic fluid they swallow. Now, let's talk about your body changes. At 29 weeks pregnant, you may notice that your belly is getting bigger, and you're feeling more and more pregnant every day. As your uterus continues to expand, you may experience some discomfort or even pain in your lower back, hips, or pelvis. This is normal, but if you're concerned, talk to your healthcare provider. You may also notice some new symptoms, such as Braxton Hicks contractions. These are practice contractions that feel like your uterus is tightening and releasing. They're usually painless and irregular, but if you're experiencing them frequently or with any pain or discomfort, it's important to let your healthcare provider know. Other common symptoms at this stage of pregnancy include shortness of breath, heartburn, and difficulty sleeping. If you're having trouble sleeping, try sleeping on your left side with a pillow between your knees to support your lower back and hips. It's also important to keep up with your prenatal appointments and any recommended tests or screenings. At your 29-week appointment, your healthcare provider may check your blood pressure, measure your belly, and listen to your baby's heartbeat. As you enter the third trimester of pregnancy, it's important to continue taking care of yourself and your growing baby. This means eating a healthy, balanced diet, staying hydrated, and getting regular exercise. Walking, swimming, and prenatal yoga are great options for staying active during pregnancy. It's also important to prepare for your baby's arrival. Start thinking about your birth plan and what kind of experience you want. Consider taking a childbirth education class, which can help you feel more prepared and confident about labor and delivery. In addition to preparing for the birth, you'll want to start thinking about what you'll need for your baby's arrival. This includes things like a car seat, crib, diapers, and clothing. Overall, the 29th week of pregnancy is an exciting time as your baby continues to grow and develop. As always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for tuning in, and we'll see you next time for another update on your pregnancy journey. Hello, and welcome to this video about 30 weeks of pregnancy and baby development. This is an exciting time for both the mother and baby as there are many changes happening. In this video, we will discuss the baby's development, the mother's physical changes, and how to take care of yourself during this period. Baby development. At 30 weeks of pregnancy, the baby is about the size of a cucumber and weighs around 3 pounds. Here are some key developments happening at this stage. Brain development. The baby's brain is growing rapidly, and the cerebral cortex is developing, which is responsible for controlling movement, sensation, and perception. Lung development. The lungs are almost fully developed, and the baby is practicing breathing movements, which will help them breathe on their own after birth. Fat deposits. The baby is accumulating fat deposits under the skin, which will help regulate their body temperature and provide energy after birth. Sensory development. The baby's senses are becoming more refined, and they can recognize sounds, light, and even taste. Movement. The baby is quite active and can move around, kick, and even hiccup. You may feel their movements quite strongly at this stage. Mother's physical changes. As the baby grows, the mother's body will also go through many changes. Here are some of the most common physical changes at 30 weeks. Weight gain. Most women will have gained around 20 to 25 pounds by this stage of pregnancy. The weight gain is essential for the baby's growth and development. Braxton Hicks contractions. These are mild contractions that may be felt in the uterus. They are not usually painful and are a sign that the uterus is preparing for labor. Stretch marks. The skin around the abdomen may begin to stretch, causing stretch marks. These usually fade after pregnancy. Fatigue. As the baby grows, the mother may feel more tired and require more rest. Shortness of breath. The growing baby can put pressure on the diaphragm, making it harder to breathe deeply. Taking care of yourself. It's essential to take care of yourself during pregnancy to ensure both you and your baby stay healthy. Here are some tips for staying healthy during the 30th week of pregnancy. Eat a healthy diet. Make sure you are eating a balanced diet that includes plenty of fruits, vegetables, and lean protein. Avoid foods that are high in sugar or fat. Stay active. Regular exercise can help you feel better and reduce stress. Walking, swimming, and prenatal yoga are all good options. Conclusion. At 30 weeks of pregnancy, the baby is growing rapidly, and the mother's body is going through many changes. It's essential to take care of yourself and attend regular prenatal checkups to ensure both you and your baby stay healthy. Remember to eat a healthy diet, stay active, get plenty of rest, and drink plenty of water. Thank you for watching, and we wish you a healthy and happy pregnancy. Hello, and welcome back to our series on pregnancy. Today, we will be discussing week 31 of pregnancy and everything you need to know about your baby's development and your symptoms. So, let's get started. Baby development. At week 31, your baby is approximately 16 inches long and weighs around 3.5 pounds. Here are some of the key developments happening to your baby during this time. Rapid brain growth. Your baby's brain is growing rapidly during this time, which means that they will be able to process information more efficiently. Lung development. Your baby's lungs are almost fully developed at this point, and they are practicing their breathing movements. Sleep cycles. Your baby is now starting to have regular sleep and wake cycles. Baby fat. Your baby is putting on more baby fat, which helps regulate their body temperature after birth. Symptoms. As you enter the final trimester of your pregnancy, you may experience some new symptoms or the worsening of old ones. Here are some of the common symptoms that you may experience at week 31. Braxton Hicks contractions. You may start to experience Braxton Hicks contractions, which are mild contractions that help prepare your body for labor. Shortness of breath. As your uterus grows and pushes against your diaphragm, you may experience shortness of breath. Back pain. As your baby grows, the weight can put pressure on your back, causing discomfort. Swelling. You may experience swelling in your feet, ankles, and hands due to the increased fluid in your body. Heartburn. As your uterus grows, it can put pressure on your stomach, causing acid reflux and heartburn. Fatigue. As your body works hard to support your growing baby, you may feel more tired than usual. Frequent urination. Your baby's position may put pressure on your bladder, causing you to urinate more frequently. Tips for a healthy pregnancy. Eat a healthy diet. Make sure to eat a well-balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins. Stay hydrated. Drink plenty of water and other fluids throughout the day to stay hydrated. Exercise. Gentle exercise, such as walking or swimming, can help relieve some of your pregnancy symptoms and prepare your body for labor. Attend prenatal appointments. Regular prenatal appointments with your healthcare provider are essential to monitor your baby's growth and ensure a healthy pregnancy. Take childbirth classes. Childbirth classes can help prepare you and your partner for labor and delivery. Conclusion. At week 31 of pregnancy, your baby is continuing to grow and develop rapidly. You may experience some new symptoms or the worsening of old ones, but there are steps you can take to stay healthy and comfortable during this time. Remember to eat a healthy diet, stay hydrated, exercise, get plenty of rest, attend prenatal appointments, take childbirth classes, and practice relaxation techniques. With these tips, you can have a healthy and happy pregnancy. Thanks for tuning in, and we'll see you next time. Hello everyone, welcome to my YouTube channel. Today we will be discussing 32 weeks pregnancy and baby development, symptoms, tips, and healthcare. As a senior gynecologist, I have had years of experience helping women through their pregnancy journey. So, without further ado, let's get started. Baby development. At 32 weeks, your baby is about the size of a large jicama, measuring around 16.7 inches long and weighing about 4 pounds. Your baby's eyes are now fully formed and can open and close them. The bones in your baby's skull are not yet fused, which allows for easier passage through the birth canal during delivery. Your baby's immune system is starting to develop, and they are producing white blood cells to help fight off infections. Your baby's lungs are also continuing to develop and produce surfactant, a substance that helps keep the air sacs in the lungs from sticking together. Symptoms. At 32 weeks, you may experience increased back pain and discomfort as your baby continues to grow and put pressure on your back and pelvis. You may also experience increased fatigue and difficulty sleeping due to the physical strain of pregnancy. Braxton Hicks contractions, or practice contractions, may become more frequent as your body prepares for labor. Heartburn and indigestion may also become more common as your baby continues to push up on your stomach. Swelling in your feet and ankles may become more pronounced as your body retains more fluids. Tips. To help alleviate back pain, try using a pregnancy pillow to support your belly and lower back while sleeping. Practice good posture and avoid standing or sitting in the same position for too long to help prevent back pain and swelling. Stay hydrated and try to keep your feet elevated as much as possible to reduce swelling. To help manage heartburn and indigestion, try eating smaller, more frequent meals and avoid foods that trigger symptoms. Make sure to stay active and get regular exercise, such as walking or prenatal yoga, to help maintain your overall health and prepare your body for labor. Healthcare. At 32 weeks, you will typically have a prenatal visit with your healthcare provider to check on your baby's growth and development. Your healthcare provider may also perform a Group B streptococcus (GBS) test to check for the presence of bacteria that can be harmful to your baby during delivery. It is important to continue taking any prescribed prenatal vitamins and medications as directed by your healthcare provider. In conclusion, 32 weeks is an important milestone in your pregnancy journey. Your baby is continuing to develop and grow, and you may experience new symptoms and challenges. Remember to practice good self-care, stay active, and attend all scheduled prenatal appointments to ensure a healthy pregnancy and delivery. Thank you for watching, and I'll see you in the next video. Hello everyone. Today, we will talk about the 33 week of pregnancy and the development of the baby at this stage. We will also discuss some common symptoms that mothers experience during this period and tips for taking care of their health. Baby development. At 33 weeks, the baby is about 17 inches long and weighs around 4 pounds. The baby's lungs are still developing and producing surfactant, a substance that helps the lungs expand and contract properly after birth. The baby's brain is rapidly developing, and they can now sense light and dark. The baby's bones are hardening, and they are gaining more fat under their skin, which will help regulate their body temperature after birth. The baby's movements are becoming more coordinated, and they can respond to sound. Symptoms. Braxton Hicks contractions. These are practice contractions that help prepare the uterus for labor. They can be uncomfortable, but are usually not painful. Backaches. As the uterus expands, it puts pressure on the lower back, causing discomfort. Shortness of breath. The growing uterus can also put pressure on the diaphragm, making it harder to breathe. Fatigue. As the body works harder to support the growing baby, mothers may feel more tired than usual. Swelling. The body retains more water during pregnancy, causing swelling in the feet, ankles, and hands. Tips for health care. Continue to eat a healthy and balanced diet, including plenty of fruits, vegetables, and protein. Stay hydrated by drinking plenty of water and avoiding sugary or caffeinated beverages. Exercise regularly, but avoid strenuous activities that could put too much strain on the body. Sleep on your side, preferably the left side, to improve blood flow to the baby and reduce the risk of stillbirth. Attend all prenatal appointments and communicate any concerns with your healthcare provider. Preparing for birth. Start thinking about a birth plan, including preferences for pain management and delivery options. Consider taking childbirth classes to learn about the labor process and techniques for coping with pain. Pack a hospital bag with essentials for both mother and baby, including clothing, toiletries, and a car seat. Talk to your healthcare provider about the signs of labor and when to call or go to the hospital. Conclusion. As you approach the end of your pregnancy journey, it is important to take care of yourself and your growing baby. Remember to listen to your body, attend all prenatal appointments, and communicate any concerns with your healthcare provider. By taking these steps, you can help ensure a healthy and safe delivery for both you and your baby. Thank you for watching, and I wish you all the best in your pregnancy journey. Hello everyone, we are going to discuss pregnancy at 34 weeks. At this stage, your baby is approximately 18 inches long and weighs around 4.5 pounds. Your baby's organs are fully developed, and they are continuing to gain weight and grow. Braxton Hicks contractions. These are practice contractions that your body goes through as it prepares for labor. They can be uncomfortable, but are usually not painful. Shortness of breath. As your baby continues to grow, it can push against your diaphragm and make it harder to breathe. You may notice that you need to take more frequent breaks or rest periods. Pelvic pain. As your baby moves into the birth canal, you may experience discomfort or pain in your pelvic area. Swelling. Many women experience swelling in their feet and ankles during pregnancy. Make sure to elevate your feet when possible and stay hydrated. Gestational diabetes. This is a type of diabetes that develops during pregnancy. If you are diagnosed with gestational diabetes, your doctor may recommend a special diet and monitoring your blood sugar levels. Preeclampsia. This is a potentially serious condition that can develop during pregnancy, characterized by high blood pressure and protein in the urine. If you experience symptoms like severe headaches, vision changes, or abdominal pain, contact your doctor immediately. Fetal movement. You should continue to monitor your baby's movements and contact your doctor if you notice any significant changes. Now, let's talk about some tips for taking care of yourself during this stage of pregnancy. Rest. As your due date approaches, make sure to get plenty of rest and sleep. This will help you conserve your energy for labor and delivery. Stay hydrated. Drink plenty of water and avoid sugary or caffeinated drinks. Exercise. Gentle exercise like walking or prenatal yoga can help you stay healthy and prepare your body for labor. Kegel exercises. These exercises can help strengthen your pelvic floor muscles and prepare your body for childbirth. Prenatal classes. Consider taking a prenatal class to learn more about childbirth, breastfeeding, and newborn care. Pack your hospital bag. Start packing your hospital bag with essentials like clothes for you and your baby, toiletries, and important documents. Talk to your doctor. Make sure to keep your doctor updated on any symptoms or concerns you may have. Finally, let's talk about your baby's development at 34 weeks. Baby's lungs. Your baby's lungs are almost fully developed, and they are practicing breathing movements in preparation for birth. Body fat. Your baby is continuing to gain weight and develop body fat, which will help regulate their body temperature after birth. Sleep and wake cycles. Your baby may start to have regular sleep and wake cycles, which can help prepare them for life outside the womb. Head down position. Most babies will move into the head down position in preparation for delivery. Overall, pregnancy at 34 weeks is an exciting and important time as you prepare for the birth of your baby. Remember to take care of yourself and stay in touch with your doctor as you get closer to your due date. Thanks for watching, and I'll see you in the next video. "35 weeks pregnancy. Baby development and symptoms." Welcome back to our channel, where we explore the incredible journey of pregnancy. Today, we're going to dive into the exciting world of 35 weeks of pregnancy. At this stage, your baby is rapidly developing, and you may be experiencing various symptoms. So let's get started. Baby's development. Your baby now weighs around 5.5 to 6 pounds and measures about 18 inches from head to toe. The baby's organs and systems are nearly fully developed, and the lungs continue to mature. The skin is becoming smoother as the fat layers continue to fill out. Your baby's brain is rapidly growing, and the nervous system is maturing. The baby's bones are fully formed but are still flexible to ease the birthing process. Symptoms you may experience. Braxton Hicks contractions. You may experience more frequent and intense practice contractions, which can help prepare your body for labor. Shortness of breath. As your uterus expands, it pushes against your diaphragm, making it harder to take deep breaths. Increased vaginal discharge. It's common to have a thicker and heavier discharge at this stage, but consult your doctor if it's accompanied by itching, burning, or a foul odor. Pelvic discomfort. The growing baby puts pressure on your pelvis, leading to pelvic pain or discomfort. Frequent urination. The baby's position and size may put pressure on your bladder, causing the need to urinate more often. Trouble sleeping. Finding a comfortable position becomes more challenging, and you may experience pregnancy-induced insomnia. Heartburn and indigestion. Hormonal changes and the baby's position can lead to increased acidity and digestive issues. Self-care tips for this stage. Rest and sleep. Listen to your body and prioritize getting enough rest and sleep. Exercise. Engage in gentle exercises like walking or prenatal yoga to stay active and relieve discomfort. Pelvic floor exercises. Strengthen your pelvic floor muscles by practicing Kegel exercises. Maintain a healthy diet. Focus on well-balanced meals that include fruits, vegetables, lean proteins, and whole grains. Stay hydrated. Drink plenty of water throughout the day to prevent dehydration and assist with digestion. Use proper body support. Invest in a maternity support belt or pillow to help alleviate back and pelvic pain. Practice relaxation techniques. Deep breathing exercises, meditation, or prenatal massages can help reduce stress and promote relaxation. Prepare for breastfeeding. Attend breastfeeding classes, educate yourself about proper latch techniques, and gather essential supplies. And that wraps up our exploration of 35 weeks of pregnancy. Remember, every pregnancy is unique, and if you have any concerns or questions, consult your healthcare provider. Stay tuned for more exciting updates on the journey of pregnancy. Don't forget to like, subscribe, and hit that notification bell to never miss an episode. Take care, and we'll see you next time. Greetings and welcome back to our Pregnancy Journey series. Today, we're diving into the incredible journey of the 36th week of pregnancy. As your due date gets closer, both you and your baby are experiencing some remarkable changes. Let's explore the symptoms you may encounter and the exciting developments happening to your little one. Maternal symptoms at 36 weeks. Increased discomfort. Your baby's growth puts additional pressure your abdomen, causing discomfort and backaches. Frequent urination may persist as your baby continues to press on your bladder. Shortness of breath can occur due to limited space for your lungs. Braxton Hicks contractions. These contractions, also known as practice contractions, become more noticeable and frequent. They help prepare your body for labor, but they are usually irregular and mild. Swollen feet and ankles. Fluid retention can cause swelling in your feet and ankles. Elevating your legs and wearing comfortable shoes can help alleviate this symptom. Nesting instinct. Many women experience a strong urge to prepare their homes for the baby's arrival. This may involve cleaning, organizing, and setting up the nursery. Insomnia and fatigue. Discomfort, frequent bathroom trips, and hormonal changes can disrupt your sleep. Take short naps, practice relaxation techniques, and maintain a consistent sleep routine. Baby development at 36 weeks. Size and weight. Your baby is approximately 18 inches long and weighs around 6 pounds. Although still growing, they are almost fully developed. Fetal position. Most babies settle into the head-down position, preparing for birth. The head engages into the pelvis, which is a sign that labor might be approaching. Lung development. By 36 weeks, your baby's lungs have matured significantly. They continue to produce surfactant, a substance that helps the lungs expand and function properly after birth. Immune system. Your baby's immune system strengthens as they receive antibodies from you through the placenta. This provides them with some protection against infections early in life. Brain and nervous system. The brain development is almost complete, with rapid growth in the cerebral cortex. Your baby's nervous system is fully functional, and they can process information and regulate body temperature. Baby's movement. Due to limited space, you may feel more rolling and stretching movements instead of kicks. Hiccups are common as your baby practices swallowing and inhaling amniotic fluid. Preparations for the upcoming weeks. Finalize birth plan. Discuss your birth preferences with your healthcare provider and ensure they are included in your birth plan. Pack your hospital bag. As your due date nears, have a bag ready with essentials for you and your baby. Include comfortable clothing, toiletries, nursing bras, baby clothes, diapers, and important documents. Attend childbirth classes. Join childbirth education classes to learn about labor, pain management, and relaxation techniques. Discuss breastfeeding. Talk to your healthcare provider or a lactation consultant about breastfeeding techniques and potential challenges. Hello and welcome back to our pregnancy journey. Today, we're diving into the incredible journey of week 37 of pregnancy. As we approach the final stretch, both you and your baby are going through significant changes. So, let us explore the symptoms and developments you can expect during this exciting time. But before we begin, don't forget to hit that subscribe button and ring the notification bell, so you don't miss any of our future videos. Week 37 marks the beginning of the 9th month of pregnancy, and your baby is almost ready to make their grand entrance into the world. Let us start by taking a look at the baby's development. At this stage, your baby weighs around 6.5 pounds 2.9 kilograms and measures approximately 19 inches 48 centimeters long. They are fully developed and are fine-tuning their systems for life outside the womb. Their organs, including the lungs, digestive system, and immune system, are all working in unison, preparing for the transition. Now, let us discuss the symptoms and changes you may experience during week 37. Increased pressure and discomfort. Host, as your baby continues to grow, you may experience increased pressure and discomfort in your pelvic region. This happens as your baby's head descends into the pelvis, preparing for birth. This can lead to a frequent need to urinate, difficulty walking, and even back pain. Braxton Hicks contractions. Host, you may also notice an increase in Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. These contractions are usually irregular and less painful than true labor contractions. Practice relaxation techniques to ease any discomfort. Fatigue and difficulty sleeping. Host, fatigue and difficulty sleeping can become more prominent during week 37. Your growing belly, frequent bathroom trips, and discomfort can make it challenging to find a comfortable position. Try using pillows for support and establishing a relaxing bedtime routine to improve your sleep. Increased vaginal discharge. Host, during this stage, you might notice an increase in vaginal discharge. This discharge, known as leukorrhea, helps prevent infections. However, if you experience any changes in color, consistency, or a foul odor, it's essential to consult your healthcare provider. Swelling and varicose veins. Host, swelling, especially in the feet and ankles, can become more pronounced at this stage of pregnancy. Additionally, you might notice the appearance of varicose veins due to increased blood volume and pressure. Elevating your legs, wearing compression stockings, and taking regular walks can help alleviate these symptoms. Emotional changes. Host, lastly, as your due date approaches, you might experience a mix of emotions, including excitement, nervousness, and even anxiety. It's essential to surround yourself with a support system and communicate your feelings with your loved ones. And that wraps up our journey through week 37 of pregnancy. It's amazing to see how far both you and your baby have come. Remember, each pregnancy is unique, so if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Stay tuned for our next video, where we'll discuss the final stages of pregnancy and the upcoming labor and delivery. Don't forget to like this video and leave a comment below if you found this information helpful. Until next time, take care and enjoy the remaining weeks of your pregnancy journey. Thank you for watching, and we'll see you soon. Hello, and welcome back to our YouTube channel, where we discuss all things pregnancy and baby related. Today, we're diving into the fascinating world of 38 weeks of pregnancy. So, let us get started. Baby's size and weight. At 38 weeks, your baby is approximately the size of a pumpkin, measuring around 19 to 21 inches 48 to 53 centimeters and weighing about 6 to 7 pounds 2.7 to 3.2 kilograms. Your little one has been growing and developing rapidly throughout the pregnancy journey. Organ development. By this stage, your baby's organs, including the lungs, digestive system, and immune system, are almost fully developed. These organs have been maturing over the past several weeks, preparing your baby for life outside the womb. Baby's position. Most babies settle into a head-down position in the uterus by 38 weeks. This is known as the vertex or cephalic presentation, which is the ideal position for a vaginal delivery. However, if your baby is not in the head-down position, your healthcare provider may discuss options for encouraging the baby to turn. Braxton Hicks contractions. You may be experiencing Braxton Hicks contractions more frequently now. These practice contractions feel like a tightening of the abdomen and are a way for your body to prepare for labor. If the contractions become regular, intense, or are accompanied by other signs of labor, it's important to contact your healthcare provider. Pelvic discomfort. At this stage, you may experience increased pelvic pressure and discomfort. Your baby's fatigue and difficulty sleeping. As your belly grows bigger, it can become challenging to find a comfortable sleeping position. You may also experience frequent bathroom trips during the night. Combined with anticipation and hormonal changes, this can lead to fatigue. It's important to rest as much as possible and practice relaxation techniques. Nesting instinct. Many expectant mothers experience a surge in energy and the desire to prepare their home for the baby during the final weeks of pregnancy. This is often referred to as the nesting instinct. It's a natural urge to clean, organize, and make sure everything is ready for the arrival of your little one. Emotional changes. With the due date approaching, it's common to feel a mix of excitement, anxiety, and a range of other emotions. The hormonal fluctuations can contribute to mood swings as well. Remember to communicate with your partner and support system, and don't hesitate to seek professional help if you're feeling overwhelmed. Hospital bag and birth plan. Now is the time to make sure your hospital bag is packed and ready to go. Include essentials like comfortable clothes, toiletries, and items for the baby. It's also a good idea to have your birth plan written out and discuss it with your healthcare provider. However, keep in mind that labor and delivery can be unpredictable, so be flexible with your expectations. That wraps up our discussion on the development and symptoms during 38 weeks of pregnancy. We hope you found this information helpful and informative. Don't forget to subscribe to our channel for more pregnancy and baby-related content. As always, take care of yourself and your little one. See you next time. Welcome to our YouTube channel, where today, we'll take you on a fascinating journey through the 39 weeks of pregnancy and baby development. From the magical moment of conception to the incredible birth of a new life, we'll explore the various stages, milestones, and changes that occur during this remarkable process. So, let us dive right in. Week 1 Conception. Host. In Week 1, conception occurs when a sperm fertilizes an egg, forming a zygote. This tiny cluster of cells begins its journey towards the uterus. Week 2 Implantation. Host. By Week 2, the zygote implants itself into the uterine lining, where it will receive nourishment and continue its rapid division and growth. Week 3 Embryonic Development. Host. During Week 3, the zygote becomes an embryo, and its cells start differentiating into the brain, spinal cord, and other essential structures. Week 4 Heartbeat. Host. In the 4th week, the heart starts to beat, and the embryo begins to take on a recognizable shape. It's about the size of a poppy seed at this stage. Week 5 Nervous System. Host. By Week 5, the nervous system starts developing, and limb buds appear, which will eventually grow into arms and legs. Week 6 Facial Features. Host. In Week 6, the embryo's facial features, such as eyes, ears, and a mouth, begin to form. Week 7 Organ Development. Host. Week 7 marks the beginning of organ development, with the brain, lungs, liver, and kidneys all starting to take shape. Week 8 Fetal Stage. Host. At Week 8, the embryo officially becomes a fetus. It's about the size of a raspberry and can start moving its limbs. Week 9-12 Rapid Growth. Host. During weeks 9 to 12, the fetus undergoes rapid growth. Its sex organs start to form, and it can make small movements, though the mother cannot feel them yet. Week 13 Trimester 1 ends. Host. At Week 13, the first trimester comes to an end. The fetus is now about the size of a lemon, and its tiny fingerprints are forming. Week 14-16 Developing Senses. Host. In weeks 14 to 16, the fetus's senses begin to develop. It can now hear sounds from the outside world and may even suck its thumb. Week 17-20 Movement Sensation. Host. During weeks 17 to 20, the mother starts to feel the baby's movements. The fetus's skin becomes covered with vernix, a protective waxy substance. Week 21-24 Viability. Host. At weeks 21 to 24, the fetus reaches the age of viability, where it has a chance of survival outside the womb with medical assistance. Week 25-28 Rapid Brain Development. Host. During weeks 25 to 28, the baby's brain undergoes significant development. The eyes open and close, and the fetus has distinct sleep-wake cycles. Week 29-32 Developing Immune System. Host. In weeks 29 to 32, the baby's immune system strengthens as it receives antibodies from the mother. Week 33-36 Lung Development. Host. At weeks 33 to 36, the baby's lungs mature, and it assumes a head-down position in preparation for birth. Week 37 full term, host, congratulations. At week 37, the baby is considered full term, and it's now ready to be born. Week 38-39 final weeks, host. In the final weeks, the baby drops lower into the pelvis, relieving pressure on the mother's diaphragm and making breathing easier. Birth, host, and now, after an incredible journey of 39 weeks, it's time for the most momentous event, the birth of the baby. It's a miraculous and emotional experience that marks the beginning of a new chapter in the lives of both the parents and the newborn. Conclusion, host, pregnancy and baby development encompass an awe-inspiring process that showcases the wonders of life. From a single cell to a fully formed human being, these 39 weeks are filled with incredible growth, milestones, and changes. We hope you enjoyed this journey with us today. Outro, host, if you found this video informative and fascinating, don't forget to like and share it with others who might be interested. Subscribe to our channel for more captivating content on parenting, health, and lifestyle. Thanks for watching, and we'll see you in the next video.
Title: 40 Weeks of Pregnancy, Symptoms and Baby Development. Introduction: Welcome to our comprehensive guide on the incredible journey of pregnancy, spanning 40 weeks of symptoms and baby development. Weeks 1-4. Week 1, conception occurs, and the journey begins. Week 2, the fertilized egg travels down the fallopian tube. Week 3, implantation takes place, and the embryo starts to form. Week 4, the embryo develops the neural tube, which will become the brain and spinal cord. Weeks 5 to 8. Week 5, the heart begins to beat, and limb buds form. Week 6, facial features and the heart's chambers start to develop. Week 7, baby's arms and legs grow longer, and facial features become more defined. Week 8, the embryo is now called a fetus, and organs continue to form. Weeks 9 to 12. Week 9, fingers and toes start to develop, and the fetus can make spontaneous movements. Week 10, the baby's facial expressions begin, and the vital organs are functioning. Week 11, the fetus is about the size of a lime, and gender can be determined. Week 12, baby's reflexes develop, and the risk of miscarriage decreases significantly. Weeks 13 to 16. Week 13, baby's vocal cords begin to form, and the digestive system develops. Week 14, facial features become more distinct, and the baby can now squint and frown. Week 15, the baby starts producing urine and the skin becomes more transparent. Week 16, baby's movements become more coordinated and the bones harden. Week 17-20, week 17, the fetus can hear external sounds and the umbilical cord thickens. Week 18, baby's taste buds form and the nervous system continues to mature. Week 19, vernix caseosa, a protective layer, covers the skin. Week 20, halfway there, the baby can suck its thumb, and the mother may feel the first movements. Weeks 21-24. Week 21, eyebrows and eyelashes develop, and the baby can taste the amniotic fluid. Week 22, the fetus is now responsive to light and dark. Week 23, rapid brain growth occurs, and lungs continue to develop. Week 24, the baby's viability outside the womb increases, though it's still premature. Weeks 25-28. Week 25. Baby's kicks become stronger, and lungs are maturing further. Week 26. Eyes open, and the baby responds to external stimuli. Week 27. Rapid weight gain begins, and the nervous system is fine-tuning. Week 28. The third trimester begins, and the baby's survival chances significantly improve. Weeks 29 to 32. Week 29. The baby's bones fully harden, and the kicks and movements may be visible. Week 30. Lungs are almost fully developed, and the baby practices breathing. Week 31. The baby's immune system strengthens. Week 32. Baby's toenails and fingernails grow, and the head settles into the pelvis. Weeks 33-36. Week 33. The baby's bones are fully formed, and the nervous system is maturing. Week 34. The baby practices blinking, and the amniotic fluid decreases as the baby grows. Week 35. the baby's liver and kidneys are fully functional. Week 36, the baby is gaining weight rapidly, preparing for birth. Weeks 37-40, week 37, full term, the baby's organs are ready for life outside the womb. Week 38, the baby's immune system gets a boost from the mother. Week 39-40, the baby may arrive anytime now. The mother might experience signs of labor, and it's time to prepare for the exciting moment of birth. Conclusion. As the 40-week journey concludes, we celebrate the incredible process of pregnancy, from conception to the miraculous moment of welcoming a new life into the world. Stay tuned for more parenting tips and guidance on our channel.
Hello everyone, and welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. At this stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional support and counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider for advice and guidance. So that's it for this week's video on pregnancy symptoms and baby development at 27 weeks. Thanks for tuning in, and we'll see you in next video. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's talk about some common symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Heartburn and indigestion are also common during the third trimester as your growing uterus puts pressure on your stomach, leading to acid reflux. Eating small, frequent meals and avoiding spicy or acidic foods can help alleviate these symptoms. Now let's talk about your baby's development at 28 weeks. At this stage, your baby weighs around 2.5 pounds and is approximately 15 inches long. Their brain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs expand and contract. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, and they can now hear your voice and your heartbeat. You may notice that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the 3rd trimester, they will be able to hiccup. So, what can you expect during the rest of the 3rd trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor.